You talk about this in your book, and it's something called anxiety as a neck up problem. Can you just talk to us more about what that means?
Yeah, I mean, that's the paradigm that we were both trained with is the way that we think about mental health is just limited to what's the neck up, just the confines of the cranium. And we're thinking about brain chemistry. We think about mental health as a genetic chemical imbalance. And there's validity to that theory, absolutely. But it is not the whole story. And there are multiple determinants of our mental health, and some of them genetic, some of them epigenetic, and some of them just environmental in our day to day lives. Not to mention the fact that as human beings, we have certain psychospiritual needs that impact our mental health. And so I like this view of panning out further than just thinking about brain chemistry because that's the part we can't do a whole lot about. We can take medication to support that. Certain therapy modalities can be supportive of our brain chemistry. But at the very end of the day, it's somewhat of a destiny. And I prefer to focus on what we can change. So, by focusing on how the physical body impacts our mental health, how our psychospiritual needs impact our mental health, that's a much more empowering and hopeful view. It's basically saying, okay, you're struggling, but there's something we can do about that.
And what are the things that you can do about that?
Basically, it starts by first acknowledging that our physical body impacts our mental health. So we can really even just start walking around and repeating to ourselves like physical health is mental health. Mental health is physical health. Our brain is a physical piece of flesh in our body like anything else. If something is going on in the physical body, it's impacting our brain. And some of those chemical imbalances that we're so focused on are actually a downstream effect of some state of imbalance happening elsewhere. And so when our body's inflamed, when our blood sugar is crashing, if we have subtle micronutrient deficiencies, if something is off with the health of our digestive tract, if something's off with our thyroid, all of this is going to impact our brain and it will impact how we feel. And so these are some of the areas we can start. And a lot of these interventions, they are themselves relatively straightforward. Like a big area of my focus in my practice is on sleep quality. A lot of us are not getting adequate quantity or quality of sleep. It's interesting how I've had patients in my practice over the years where every once in a while there's a silver bullet. Not often, but sometimes I just fix somebody's sleep, and that actually has this impact on the rest of their mental health. And really, so much of what was considered a lifelong diagnosis was really how chronic sleep deprivation was showing up.